Dear listeners, and welcome to the agenda. Today, we are tackling a critical health topic that's been making headlines globally, which is mpox, also known as monkeypox. This viral disease has raised concerns worldwide, and Zambia is no exception. So, join us as we delve into the facts, we will debunk the myths, and explore the latest updates on mpox. Our expert guest will share insight on symptoms, prevention, and treatment options. So stay tuned for an informative and engaging discussion that will equip you with the knowledge to protect yourself and your loved ones. So let's get started. I'm Jack Mwapembolo, and in the studios, I'm joined by Mr. Chanda Bryan, Health Promotions Officer. Mr. Chanda, good morning.
Good morning to you.
I also have Madam Esther Kalasa, who's the Clinical Care Officer. Madam Esther, good morning and welcome to the program.
Good morning, thank you. How are you, Mr. Mbulu? And how are you?
As you had the issue to do with mpox, for a start, can you explain what mpox is?
Okay. Thank you so much. Yeah, like you earlier mentioned, this is something that has sparked a lot of discussion and some fear in everyone globally. So this it's a disease that is caused by virus. Yeah. So the name came from because it was identified first in monkeys. That is where the name was derived. So it's just a viral infection, but presents smallpox. But we'll be able to explain further how it affects the human beings. Yeah, so basically that's just what mpox is.
Mr. Mbolo, just to add to what the clinical care as explained. So basically, what we need to know about mpox is it's explained where the name is derived from. And the other thing that we need to know is it is caused by a virus, because there are billions of viruses, Mr. Jackie. Yeah, so actually called mpox virus. So the disease is caused by mpox virus, and the viruses have families, just like human beings. You come from a Mbulo family. She comes from the Kalasa family. They come from families. So this particular virus is also coming from a family where there's chicken pox. Yeah, there's chicken pox. So no wonder when we come to the signs and symptoms, Mr. Mburo, you see that even the presentation or the way in a layman's language, the itself brings up itself for identification. It somehow looks like chicken pox.
But it's like how the same chicken pox or smallpox.
Okay.
Okay. Thank you so much. So I'll mention some different similarities, like the rash itself, but then there's a difference between the chicken pox rash and the mpox rash. So at maybe it will last for 1 or 2 to 3 days. Yes, as 2 days. Yeah, so we can see those similarities. But then for the rash appearance in mpox, we have big lesions in mpox.
So tigera mu kibemba kifire fitumba.
Fire fitumba muri chicken pox, we see that umuntu arakwata kwatsi to rash not kwata menshi filia, but in mpox we see the rash is quite bigger, and then the development of the same rash in mpox the person has rash the entire body, but then for mpox the rash, the progression is a bit slow dying. But for mpox, we see about 10% of people dying. But then we also have another significant feature that we don't see in chicken pox, which is I can say muchubemba umutantamfula.
Okay.
So for chicken pox, we don't see people having swollen lymph nodes, but in mpox we see those. So there's generally swelling of the same lymph nodes. So usanga tumuntu nakwata omutantamfula mumukoshi mumapa, like swollen everywhere. So those are the differences between chicken pox. I'm talking more of chicken pox because it's common, especially in Zambia. We have a lot of chicken pox cases, but then we have those differences to note.
Okay, so what are the common modes of transmission for mpox now?
Okay, so the common modes of transmission for a disease to be transmitted, Mr. Jack, there are factors that we look into. There's what we call MOT, or mode of transmission. Yeah, so modes of transmission are different. Can it be, is it a contact, or rather vector? Should I say, is it transmitted by their fecal-oral transmission, where someone drinks water which is contaminated with maybe feces? Those diseases, we call them fecal-oral. But there are also aerosols or airborne diseases. Yeah, so this one is classified actually through contact. So for someone to be infected or to catch, to get this infection, they must have been in contact with either an animal which is infected with the disease, or a human being who has an infection. So this disease is transmitted through contact with a person who is actually infected with the infection. And I must mention, Mr. Jack, that science has also proven that unfortunately this disease can also be transmitted sexually. Yeah, so during sexual contact, someone can also get this infection. So you find that someone might not know where they got it. They might have not come in contact with any person, but probably through the sexual contact or act that they had, they might have gotten the infection from the other party. And then also animals, that you find a dead animal, you find something, could be a game meat, dead by itself, someone just gets it. There may be possible chances that someone might get the infection from there. Also, respiratory contact, what we call aerosols. You get a mirror or something, you stand by the window and then you breathe. There's that mist. Yeah, so when you get close to someone who's actually infected with this mpox, you can also get. So primarily what we are saying is a person who get infected by getting close contact to an infected person.
So it's one disease that affects both genders, men and women.
Yes.
Women, including children. to what Mr. Chanda has shared. I think we've seen like Ada mentioned when I was talking about how it presents itself. You find people having those blisters, like even just things with someone who has mpox, you contact it and you actually get infected with mpox. I just wanted to highlight on that.
Okay, so dear listeners, we're still talking about the issue of mpox, and we get to hear in detail what this disease is. Now, let's talk about the symptoms appear.
Okay. Thank you so much. So from the time you contact the infected material or the same aerosols, umuntu akupeme nayo nangu akusabusha na tumateni body fluids. It takes about 3 to 5 days for you to start showing symptoms. So you have a fever. I mentioned that there's fever in mpox, which will last for. And I would like to mention that the symptoms are self-limiting as well for most viral infections. So you find that when you have a viral infection, the symptoms are self-limiting.
Which means
It's resolve, but it just takes some time.
Okay.
Like the way it happens when we have flu. Today you wake up sneezing, tomorrow you wake up with a running nose, just like that until it swollen glands, like I mentioned, meat and down flying. And then we also have muscle pains, backache, and then just generally feeling weak. You know, the body is sick, so trying to fight all those infections. So we tend to see people are feeling weak. And then the most common symptom, which is a rash, the one that we are talking about, which has a lot of blisters. And then we have sore eyes. I mean, red. Yeah. And then we also have pain in the rectum. And then we also have difficulty in urinating because of those blisters. Mr. Chanda mentioned that this can be also sexually transmitted.
Yeah.
Yes. So we find that people will present with such symptoms. I think these are the symptoms that we commonly see in people that have monkeypox disease.
And for children, because sometimes maybe even you said even babies can have the monkeypox.
Yes.
So I don't know how you can notice that this baby, they cannot present the blisters. Like, do the blisters come the same day? Or
Okay. Yeah. So the blisters will not start the same day. Like I mentioned earlier, the rash doesn't develop rapidly like as seen in chicken pox. But then we see these other symptoms, and that's why we keep on encouraging everyone to visit the health facility whenever they notice that they are not feeling well. Most of the time, children will present with fever. Yeah, we have this notion of saying mwana akaba omubiri se ntumupeere kufe panado limbi meno ayalefuma limbi taleyonka, because we've seen cases where children present with blisters in the mouth. So mwana limbi taleyonka, and then the parents will take it, okay, maybe the baby is teething. So we are encouraging everyone to just visit the facility whenever they experience such symptoms, because we notice that fever is actually the first symptom. So if you overlook that fever, you may just be waiting for these other appear. So whenever anyone experiences any of these
No. What Madam Karasa is saying is that when we come to the medical perspective, you'll be taught that the rash presentation itself is different from the way the chickenpox presents. When me as an expert, I'll look at the rash, I'll see the way the bumps are looking, the way the flatness of the bump is looking, and the way the chickenpox rash is looking is different. But the lay person out there is unable to differentiate that. So what we want is when you see any rash, please rush to the nearest health facility. What we want is an early detection, Mr. Jack. When you detect early, we treat promptly, we treat our patients with the adequacy and the promptness that it is actually required. Like she mentioned, the atypical sign that we can see that someone might have mpox is the lymph nodes. Someone may have a rash, but generally down from but the lymph nodes that someone will have, they are generalized. They are everywhere. Where there are lymph nodes in the body, you find that all the lymph nodes are solid. This is different, and it's not common to any other disease. So when you see that, quickly rush to the health facility. And we are not actually encouraging people to wait to see results. When you see any rash, when you see fever, especially in children, please rush to the health facility for care and attention. Thank you.
Okay, they say that prevention is better than cure. So, what are the best ways to prevent mpox transmission?
Okay, thank you so much, Mr. Jack. So, how do we prevent mpox is critical. Yeah, so we need to look at the mode of transmission, like I mentioned. So how is it transmitted? We are saying by contact from the uninfected person. So we need to avoid contact. That's the first person. Mtende wapa Paulo. Just like in COVID time, we need to avoid handshakes. Let's develop what we call high hygiene practices. We need to regularly wash our hands, Mr. Jack. Yeah, so I knew someone in the past who would come home. When they come home, before they touch anything, before they greet anyone from home, they would want to wash their hands. It didn't make sense until I went into the medical field. And it makes sense now because we greet a lot of people, Mr. Jack. We touch a lot of things. You are in ShopRite, you see? So you don't know what you are touching. You don't know who touched that. So through contact, you may pick the virus and you are infected. Hand hygiene is very important. Let's wash our hands regularly, and then we need to avoid contact. And then you can also practice these things. Stay home if you feel infected, because if you feel you have an infection, when you stay home, it's part of prevention. You are avoiding taking the infection out there or transmitting it to other people. Then we also need to avoid touching animals, pets. Uh, to find any animal that is dead by itself, please avoid touching such things in public. Then we also need to avoid the visiting. That's why from us as experts, when you find someone infected, would want to isolate them, isn't it, Madam Kala? So we
Yes.
want to isolate them to avoid further infection to the public. But in an event that someone has not presented themselves to the facility and you are suspecting that these people have, please rush them to the nearest facility and avoid touching them. It actually helps preventing the infection, Mr. Jack. Then we also need to do what we are doing during COVID time, avoid unnecessary crowded places, because in crowded places, you find that it's very possible for you to find yourself in contact with different people. Yeah, so basically those minor and uh, easy things, Mr. Jack, helps to prevent the mpox. So what we need is the public just to adhere to general personal hygiene, and also those mentioned things like avoid touching pets, avoid it helps. Thank you. Madam
And
Council.
there is something that she mentioned earlier on about exchanging clothes. I think you
Yes.
can emphasize on that one also.
Oh, yeah. Thank you so much. So, so the key thing for prevention of any disease is by avoiding the modes of transmission.
Yes.
Yeah. So we've seen that in mpox, that rash has got fluid in it, and so when the skin is inflamed, it's easy to break. So you find that nangu muntu nalala fye nangu nafwala, you find that the rash will actually start now breaking, and then the fluid will be all over the clothing material, including the beddings. Yeah. So especially where we see that this person has let's avoid exchanging clothes. Even just apakulala. We are encouraging that those people that have symptoms use different beddings and clothing. We don't want further exposure to other people that are not yet infected with the same because it's quite infectious.
Okay, so are there any vaccines or treatments available for mpox? I think that's what the listeners would want to hear.
Okay.
Okay, so vaccines at the moment, we do not have any vaccine. Yeah, so treatment, most of the viral infections, they do not have what we call specific treatment. Yeah, so we treat what we call symptomatic. Yeah, so we resolve the symptoms. If someone has rash, we target the rash. If someone has a fever, we target reducing the fever. Like Madam Kalasa mentioned, I think earlier, she said that we find the flu resolve on its own as days goes by. So we may give Piriton for flu, we may give a Panadol just to reduce the pain or the headache that someone has. That doesn't mean we are treating the virus or the flu. No, it will resolve on its own. Yeah, so the viral infections, Mr. Jack and the public, most of them do not have a specific treatment, because treatment, for example, malaria, when you are giving coartem, our target is to go and kill the parasite in the body. That's what we call treatment. Treatment is killing the causative agent or the causative organism. You give the medicine to go and kill the agent. But for the viral infections, we do not have specific medicines to go and kill the virus. So the viruses, the symptoms will resolve on their own, and the infection will clear just like that. But what we treat are the symptoms. are the things that someone is presenting with. If someone has rash, we'll treat the rash. If someone has headache, we'll treat the headache and also bring down the fever.
Okay. You wanted to add something?
Yeah. So maybe someone out there may be wondering, then why are you encouraging us to visit the facilities if there is no treatment for mpox? So mpox is treatable but not curable.
Yes.
Okay.
So most viral infections will cure on will just be
Managed.
they'll just be self-limiting.
Okay.
Yeah. So as long as a person pulls through the entire process of the disease, they should be able to recover just fine. But then the reason why we are encouraging people to come through to the facilities because we want to give supportive care. So we said that there is fever that almost everyone, I'm sure, knows by now. Umwana ng'akwata omubiri okukaba. Children end up fitting. So now there's no way that can be managed effectively at home. So that's why we want, if a child has fever, let them be seen at the facility so that the fever is controlled, just to improve the person's condition. And then we have that rash. It may break. So that will put the person at risk of acquiring other bacterial infections. So we are going to cover everyone on antibiotics so that we just prevent any further infection with other superimposed bacterial infection in the mpox virus.
Maybe just an addition to what she mentioned, Mr. Jack. So, like she mentioned, people would say, now, no mutakut, you get it. Yeah, so what we want is the early identification. Yeah, you might be saying it's chicken pox. You might be saying it's just any other rash. And most of the people come to the hospital when the prognosis, or rather the condition of the person is not in good shape. So what we want people to come early, and management of the patient is better when someone comes early. Because when someone comes late, it's difficult to find that the organs have been affected and the person is already in critical stage. You start now what we call, Mr. Jack, resuscitating the patient. So when someone is being resuscitated, there are two things involved. Someone might be resuscitated or they may not be resuscitated. So what we want is someone should come in good shape and we treat them in good time. That is very, very important.
Okay.
So basically, we're just trying to manage the complications that may come so that we even reduce the period for the disease. So when things just go as the disease itself has been studied, we expect mpox to resolve on its own within 2 weeks. To the immune compromised, immune system yabotaidi sana win. So we find that those may require hospitalization and management at the facility, but we expect the symptoms to go away on their own within 2 weeks. Yeah.
Okay. And do you have any cases, like in months, have we recorded any cases of mpox?
Currently, we have not recorded any cases of mpox, and I think kudos to the community itself. I think people are alert and they've been visiting facilities when they experience symptoms such as they are alert. They know that they need to visit the facilities. So I think we are working together with the community, and we haven't reported any case of mpox in Mansa.
So actually, even the entire province, Mr. Jack, we have not had any confirmed case of mpox. But like Madam Kalasa mentioned, our surveillance system is very, very strong. And from the time I think we had this threat, there are so many samples that have been sent to Lusaka, to the virology lab, to make sure that we confirm whether we have any case of mpox. So our surveillance system is very, very strong on the ground. We have had the suspected cases in different districts where we have collected samples from the suspected cases and sent to Lusaka for verification and the confirmation. But as we speak right now, we do not have any case, any confirmed case of mpox. So as a province, we do not have any case.
And I know, yes, we might not have the cases of mpox, but have you had any myths around this disease that you would love to dispel? Because we want the listeners out there to have the accurate information. So there might be maybe some information that is not true that people out there might be sharing that might even put the lives of those who might have it at risk. Have you heard any of the myths around flying around?
So on mpox, so far, Mr. Jackie, I think there have been no myths and misconceptions. I would say maybe misconceptions because the myths obviously are different from misconception. Yeah, so misconceptions are just misrepresentation of the truth. Yeah, so like we said, people might be mistaking mpox for chickenpox, or chickenpox for mpox, vice versa. So those are some of the things that we have seen, and the alerts that we have noted around. I think the alerts that we have so far had, they've just been cases of chickenpox, and then the people are suspecting to be mpox. And I think it's always a case if a disease is new. Remember when COVID came, there were so many issues until people became experts in managing the condition. So even mpox, when it just came, I think even clinicians would, be not sure until people read more, until people research more, until guidance has been given, and now people are able to pick to say, no, this is not mpox, this is chickenpox. So there are those misrepresentation of the truth, and because information, like Madam Esther has mentioned, is out there, Mr. Jack, now. People have been informed, people have been sensitized, and the communities have already been, awakened, because awareness campaigns are being done in the community. Yeah, we have already trained our health workers in management and in, identifying mpox, and further, our health workers have gone down on the ground because Ministry of Health structure starts from the community. So our community health workers, our foot soldiers on the ground, have been given this information in raising awareness on the ground. And so the public out there, the communities have the information, and they are on high alert, like Madam Kalasa mentioned. And so when they see any rush, you know what happens in the community. They would want to signal the health facility to say, we are suspecting this. And that is what is actually happening on the ground. So not necessarily that we have myths or but these conceptions are there because people are trying to compare what they know to mpox.
So when you get those symptoms, which health facility do you have? A specific health facility where you can go to, or you can go to any health facility?
Okay. So currently, we are encouraging everyone. We have a lot of facilities in Mansa, and I think they are close to the family as possible.
Mm.
So we are encouraging everyone to just go to their nearest health facility. I think all our healthcare staff have been equipped with the information and skills on how to manage this mpox. So we are actually ready to receive any case at any health facility within the district.
And are you collaborating efforts with the schools? I know they have opened, and we might just have, there's close contact with within the pupils themselves. Are you working hand in hand with the Ministry of Education
Thank you
in terms
so
of
much.
sensitization?
Okay, thank you so much, Mr. Jack. So as opposed to in the past, we used to call it sensitization. But sensitization is more limited. Yeah, so what we want now is to do what we call SBC, that's social behavioral change,
Okay.
because our target now is to change the behavior of the community. If the community can change behavior and have the information, then they can do what we call make informed decisions. Yeah, so actually COVID taught us a lot of things, Mr. Jack, I should mention, because we used to force people to wear masks. At the point where we reached, people knew the importance of wearing a mask. We stopped running battles with people. So that has been our methodology now. We want people to get the benefits of what we are telling them. Yeah, so we are doing a lot of campaigns. Like I mentioned, our health workers were trained. We have had a number of meetings, Zoom meetings, physical meetings, trainings, orientation, and then one of the activities that we are doing is what we call school health services. So school health services is where we have a package, Mr. Jack. We go into a local school. For example, we have Central Clinic. So Central Clinic has a catchment area where they have a number of schools in their catchment area. This week we are visiting 2 schools. Next week we are visiting so many schools until all the schools in their catchment area are visited. So the schools are being visited for the health service, other health related activities. We go there for sanitation, we go there for water related, we go there for vaccination. So mpox is also integrated in those activities that we are doing. I can cite an example of I think a facility called Kapompwa. Like yesterday, people went to what's that school? Chile. There was an issue to do with the water, and the school called the facility just to visit and make sure that the pupils are safe. And we take advantage of that, Mr. Jack, to make sure that the activities are actually happening in schools, and pupils are sensitized on mpox. They are sensitized on most of the what we call communicable diseases, because mpox is also a communicable disease. So those things that can be communicated and transmitted within a school, we take advantage and usually sensitize or offer awareness to our pupils, including the teachers. So I would also be quick to mention, Mr. Jack, that we have a very good relationship now with Ministry of Education. We have a program running that we are calling Health Learners. So we are turning a number of teachers into a mini doctor within the school. So what we want is that person that we have trained with basic information about health, they can see the pupils, they can tell the pupils, because they are found with the pupils every day. So they can give them information, and then when need arises for an expert from health to go there and visit, we are usually called upon. And this partner that has come on board in actually 4 districts now. We started with Mansa, we are in Kawambwa, we are in Sanvia, we are also in Mwense now. So this program, the funder or the partner has actually built infrastructure within the school premises where our pupils, as we used to call it in the past, Mr. Jack, we are saying sick bay.
Mm.
But now we have a health room where pupils can go there, be nursed by a teacher who's trained. They are not only going there to be nursed, but they are going there for health information. They can get health information and be trained and actually be informed about several things about health.
Okay, as we are about to end our program, any information that you would love to share with the listeners out there? I'll start with Madam Esther and then we'll end up with Mr. Chanda.
Okay, thank you so much. I think the successes recording towards not recording any case in Mansa cannot go without appreciating the listeners themselves. We appreciate that the surveillance has been heightened in the community. We have a lot of cases that have been reported to our facilities. It means that the community is playing their role to just have this disease in the net. Yeah. So at health facility level, we have community structures that have actually been capacity built as rapid response teams. So these teams are able to go even in the community to just follow any case that may be recorded or may be reported in the community. So we are encouraging the community not to drop their guard. We are still fighting this disease since it has been declared an outbreak. So let's not drop our guard. Let's just continue reporting even those cases that we think are chickenpox cases. Let those be validated by healthcare staff that indeed this is just chickenpox and not mpox. Thank you.
Mr. Chanda.
Thank you so much, Mr. Jack, KFM, and the general public for according us this chance to come and share the information to the listeners. It's very, very important, and I think what we are encouraging our listeners, Mr. Jack, is that let's run to the facility. Let's run to the health facility for health care. When you see any rash, confirm rash, the onset fever, mwana, please run to the health facility. We have experts like Madam Kalasa and other people in the facilities. Like she mentioned, in particular for Mansa district, we have a number of health facilities nearby to the families. So you do not need to come to Mansa General. You do not need to go to a far facility. Go to the nearest, and then there are experts there. They will see you and attend to you. Lastly, but not the least, I would mention, Mr. Jack, that if we believe in prevention is better than cure. It's actually prevention is cheaper than cure because you will not spend money when you prevent the disease. So mkwaina tumanakapi nokumonokowati we champion and prevent mpox in Mansa and in Wapula as a whole. Thank you.
Thank you for coming to this program, Madam Esther and Madam Esther Kalas and Mr. Chanda Brand. Thank you for making your time to be on this program, and thank you for tuning in to today's program on mpox. We hope you found the information helpful in understanding the virus, its symptoms, and how to protect yourself and your loved ones. Remember, mpox is a preventable disease, and by taking simple precautions like frequent hand washing, avoid close contact with infected individuals, we can reduce its spread. If you or someone else you know is experiencing symptoms, please seek medical attention immediately, and let's work together to stop the spread of mpox. Thanks again for listening. Stay safe and stay informed. Tune in next time for more health-related topics and discussions. Goodbye from me, Jack Mapembulo, and on behalf of Madam Esther, Mr. Chanda, and of course on behalf of the KFM team. Join me on Friday for another edition of Agenda. Thank you so much. I thought I knew a lot about mpox. I've learned a lot.
That's good to know.
Thank you so much, Mr. Jack.
Next time we'll give you more time.
Oh yeah.
prepare.
Mondays are difficult. Yeah.